Hello everyone, welcome to SW News. The coronavirus is spread far and wide in India. While the official health ministry data shows that the number of new cases have decreased, several ground reports from the hinterland of India reveal how the virus has led to health havoc in the small cities and villages across the country. In the absence of basic facilities like testing, tracking, medical infrastructure, the villagers are falling prey to the deadly virus. The situation is so bad that the absence of wood for cremation, the dead bodies of suspected COVID patients have been found floating in Ganga river. We have done a video on this issue. Dainik Bhaskar, a Hindi daily, had sent its reporters in 27 different districts on the banks of Ganga river, and what they found was nothing less than shocking. Kanpur, Prayagraj, Unnao, Ghazipur, Bhadohi, Varanasi, Mirzapur and several other districts, they witnessed scenes that was like witnessing a dystopian reality. Dead bodies buried in sand on the river banks, dead bodies floating in the river for days, some dead bodies defaced by animals and vultures. The authorities have finally woken up to the issue and are appealing people to not dump the dead bodies in the rivers. But this is just one part of the reality of the medical infrastructure, basic COVID infrastructure in rural Uttar Pradesh. Commenting on the issue, the Allahabad High Court today said that the health facilities in the rural areas of Uttar Pradesh are Bharose, which is at the mercy of God. A division bench of Justices Siddharth Verma and Ajit Kumar said that the entire medical system of the state pertaining to the smaller cities and villages can only be taken to be like a famous Hindi saying, Ram Bharose. The remarks were made in light of the COVID patient who was reported to be missing from a district hospital in Meerut district. The court had earlier sought a report on this matter. Today, when the entire facts of the incident were narrated to the bench, it noted that it is a case of high-degree carelessness on the part of the doctors who were on duty at the time. The bench has asked the state government to take stern action against those responsible. Maybe they are the highest in the ranks. It has also directed the government to compensate the dependents who have suffered the irreparable loss because of such carelessness. Now, what was the case exactly? When Santosh Kumar, aged 64 years, went missing from the district hospital in Meerut on April 22nd. In an inquiry conducted by a 3-member committee, it has come to light that on the said day, when the patient had gone to washroom, he fainted there. A junior resident doctor from the hospital who was on night duty told that Dr. Anshu, who was on night duty as well, was not present at that point of time. She also said that Santosh Kumar was brought upon a stretcher in fainted condition and efforts were made to revive him, but he succumbed, and by the time efforts were being made, the morning team had arrived. Now, Dr. Tanishq Utkarsh, who was on duty when Santosh Kumar was admitted to the hospital, got the body removed from the place and all the efforts to identify the person went in vain. He could not trace out the file of the patient in isolation ward, and even after counting the number of patients and file, the dead could not be identified. And thus, it was taken to be a case of unidentified body. Commenting on the explanation, the entire narration of the incident, the bench said, if this is the state of affairs of treatment at a medical college in the city like Meerut, then the entire medical system of the state pertaining to the smaller cities and villages can only be taken to be like a famous Hindi saying, Ram Bharose. Now, while on one hand we are seeing reports revealing the grim reality on ground in Uttar Pradesh's villages, the government, however, has said that the situation is not at all alarming. UP Chief Minister Yogi Adityanath on Sunday said that the pandemic situation in Uttar Pradesh is neither alarming nor out of control. He said that UP is even prepared for a third wave of COVID-19 if it comes. Extra test kits and medical kits and surveillance teams trained in COVID management have been dispatched to villages to check the spread of the pandemic in rural areas. Now, this is what the Chief Minister is saying. However, the Allahabad High Court tore into the government's claim as it pointed to the lack of testing and tracking facilities available in the rural areas of the state. In the stinging critic, the Allahabad High Court bench said that the citizens of UP are being led to the third wave of the pandemic. It noted that the health infrastructure is absolutely insufficient in city areas to meet the requirement of city population, and the rural areas, the community health centers are virtually lacking in respect of life-saving gadgets. In most of the districts, the level 3 hospital facilities are not there. The court noted that in a district like Bijnor, there is no level 3 hospital despite a population of over 1 lakh residing there. The 3 government hospitals have only 150 beds, whereas the total number of BiPAP machines is 5 and high-flow nasal cannula is only 2. The court was also informed that RT-PCR and antigen testing is being done in 60:40 ratio, but court expressed its unhappiness over this figure and said that if we fail to identify a COVID-infected person at the earliest, we are definitely inviting a third wave. The manner in which the pandemic has hit the rural areas of the state, the district administration is required to have a robust way of conducting tests. For a rural population of 32 lakhs, as is the case of District Bijnor, every day 4,000 to 5,000 tests should be conducted, and all the tests should be through RT-PCR. It also added that 30% of the population is to be tested, which is roughly around 10 lakhs in the rural areas of District Bijnor within 3 months' time. Then at least 10,000 tests have to be conducted per day. However, it said from the statement made by the district magistrate of Bijnor, it doesn't seem that such robust testing in near future in District Bijnor will be available, and the condition in other 4 districts is also the same. It said, if this is the state of affairs of 5 districts in Uttar Pradesh, one can guess where we are leading people of this state, that is, to the third wave of the pandemic. Now, this is what the court said. The concerns were, however, raised on the COVID situation in densely populated rural areas of the states like UP and Bihar. Concerns were also raised on the accuracy of the COVID data provided. However, Yogi Adityanath, addressing reporters in Noida, said that the state is not hiding anything. Everything is transparent. Every detail of testing, recoveries and deaths are uploaded on the government's COVID portal. He said a committee including members from multiple departments has been set up to monitor the situation. Besides the district hospital with 1,200 to 1,500 beds, community health centers in villages would also be provided with people trained at Gorakhpur Medical College and KGMU Hospital in Lucknow. Well, this is what the state has to say, and this is what the Allahabad High Court had to say. Do let us know what you think about this in the comment box below. For more news and updates, you can log on to www.hwnews.in. Hello everyone. HW News English is 2 years old now. When we started this venture, we promised ourselves one thing, that news should remain free, because right to know is the right of every Indian. But to keep news free for everyone, we need support from some of you. And thus, we have rolled out membership on our YouTube channel, HW News English. But mind you, the membership is completely voluntary. The programs that we were doing earlier, that we are doing now, will continue to remain free. First level is a basic level. Here, you can be our supporter by paying Rs 199 per month. This membership gives you certain perks and benefits. The perks include unique badges in front of your name, a live show from Mr. Sujit Nair and from Mr. Akhilesh Bhargava per month for our members. You can also vote in some exclusive members-only polls. Now the second level is Super Supporter. Here you can be our Super Supporter by paying Rs 3,999 per month. This membership will include every perk that comes with basic level. Additionally, our super supporters can be a part of a WhatsApp group where we can have discussions and suggestions on various topics. The second perk includes a gift pack with our merchandise. And the third perk is a Google Meet with Mr. Sujit Nair, where you can join the meet and ask your questions to Mr. Nair face to face. Lastly, if you like, we would give a shout out to our super supporters in our programs. So, Hope to see you soon with our badges.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.